Thank you for joining us today. I am Yolanda Gotier with the Center for African American Health. As an organization, we were established to support the health and wellness of African Americans precisely because of the persistent health disparities that have plagued us for generations. We not only know that Black Lives Matter, but we also know and support the quality of life for Black lives is our mission. The inequities across the various social determinants of health, including mental health, education, income, life expectancy, and more, all have the same root cause: systemic racism. And it is from that lens that we introduce today's topic of telemedicine, a vital and important practice of caring for ourselves remotely when we are perhaps unable to see our physician in person. We're very grateful to have with us today an expert in this field, Dr. Dennard Ellison, whose work spans for more than 3 decades and is someone who is keenly aware of the importance of telemedicine, given his practice as an ear, nose, and throat doctor in the San Luis Valley. Tell us about how you've incorporated telemedicine in your work in the San Luis Valley, Dr. Dennard.
Well, thank you, Yolanda, for inviting me to participate in this interview today. But I practice in San Luis Valley, which is a community of approximately 10,000 residents. And the rural community, not only in San Luis Valley, but across America, may have been on the forefront of using telemedicine services previously. But this global pandemic has revolutionized and accelerated the progression of telemedicine within healthcare today. With the ideas of using social distancing as one of the tools in fighting this global pandemic, telemedicine has entered the offices and practices across America. And like others in San Luis Valley, specialists, primary care providers, and ancillary services have used telemedicine to provide an avenue and accessibility for healthcare in the San Luis Valley. Particularly in the ENT, it's somewhat unique, and some of the early symptoms of the global pandemic of COVID are somewhat similar to a lot of the things that I experienced in a patient-physician relationship. Many of those common complaints, such as a sore throat, nasal congestion, loss of smell and taste, may mimic other common processes such as allergies, which can be confusing in this global pandemic with some of the symptoms that we see with COVID. Accessibility to healthcare has always been of vital importance in the rural community. And particularly in this time, in this global pandemic, it's been highlighted as on platform, how can we access patients that are needed to access their current complaints, whether they're chronic underlying conditions, which may be asthma, hypertension, cardiovascular disease, diabetes, or current concerns about possibility of exposure to COVID. Telemedicine has provided an excellent resource. We have a director of communications, Donna Weehee, who has been very, very excellent in providing ability for the community in San Luis Valley to access services through telemedicine. Me specifically in ENT, we're currently using maybe 10 to 20% of the patient contact that I'm using, since we have actually reopened our office for patients that we can see in the office. But yes, I understand patients are concerned. Exposure to potential others that may be sick, people with pre-existing conditions should be concerned. The elderly population, anybody with an immunocompromised state, telemedicine is another avenue and is a complement to services that any office can actually evaluate and treat patients. It can depend on accessibility. It can run the gamut from unusual phone call or use a virtual platform where you actually can interact and see the providers providing care to you.
Okay, so given the fact that we've got people who are listening and they may be concerned around how they can safely receive medical care for a serious ailment during this pandemic. Can you provide any guidance around that? So it's not somebody that's just calling to say, perhaps I have a sore throat, but they know that there's something else going on.
I really believe that people should really listen to their bodies. Despite we're in this global pandemic, there are other serious medical conditions that we need not avoid or put off. Cardiovascular disease, heart attacks, strokes, uncontrolled diabetes. All of those things have an effect on the American population at a great level in terms of numbers in COVID. COVID is on the forefront of the media right now, so it's receiving a lot of attention. Yet we must not dismiss those other conditions that have a more impact on a daily basis, no matter what ethnic, demographic, or socioeconomic background they're coming from. So I think it's very important to listen to your bodies. If something is wrong, don't fear not reaching out to an emergency room. Don't fear reaching out to your primary care provider. They may be able to answer your questions via telemedicine. They can triage and direct you to someone if there's more attention that's needed on a higher level of care.
Okay. And in adopting this platform, like telemedicine, and I know that you have been using it for a while in the San Luis Valley, how are patients really adjusting to not having that contact, personal, reach out and touch contact with their physician? And how rapidly has the implementation been in a virtual setting? In addition to, how have you seen the trends and how this is specifically impacting the Black community?
Well, with this global pandemic, there's been, as I stated earlier, there's such an acceleration of the need for something like telemedicine. It will never replace patient face-to-face contact between the physician and their patients. Yet it serves as an excellent complement. It depends, it's specialty driven. Some specialties might provide an excellent way that you may get an extensive evaluation, whether it be a skin disorder with a dermatologist. They can assess a lot of the patient's problems just by visual inspection through a telemedicine. But also important, preventive medicine and education is another important tool that telemedicine can provide. Compliance with medication, blood pressure medication, asthma medication, questions that a person may have concerns. It's an excellent triage tool that a physician may use to determine, as I stated earlier, whether you need to come and see myself or anyone else for a more serious ailment. Over the past 4 months, I think what we have accomplished in telemedicine within the healthcare field is probably 10 years worth of work, because it was thrust upon everybody all of a sudden. We knew it was there, but for different reasons, we as physicians may have failed to utilize this as an excellent tool. There are some things that make it somewhat difficult depending on the individual's digital literacy. Broadband connectivity has been somewhat of a problem, particularly we're in a demographic area where we're in a very mountainous community, so accessibility to broadband connectivity has presented some problems. But the gamut can run from a simple phone call to actual virtual platform where you actually can see your physician. So we're able to cover all these areas. In terms of your question concerning the Black community specifically, I have some colleagues that are currently working in Los Angeles County, in the inner city in Watts, Willowbrook, and Compton. He has found that there's a variability in the digital literacy of his community. The majority of his patients are seeking out telemedicine, but simply through phone calls. But what is different as a physician, we are allocating specific time for telemedicine. In some practices, it may be 50% of their current practices, and some it may be less. But what's the beauty about it? I'm able to, on a personal level, able to express the art of medicine. I'm actually allocating time and I'm sitting and talking to patients. I'm not looking at a clock. I'm actually talking to them and really deep diving in some of their concerns that they may be having. So that is a very positive on a personal level that I find from telemedicine. You can really sit down and talk to the patients. You have an allocated time just to do that. And I think I found my colleagues to find that a very similar satisfaction.
Okay. So as you know, we're on Facebook Live and we are receiving questions from those who are watching us. And so while you may have answered this in part, I want to make sure I'm addressing the specific questions that are coming in. So one of our questions is, our elders would likely benefit from telemedicine, but may be intimidated by the need and use of technology. How do you recommend that we bridge this technology and this technological gap to help our elders with medicine, with the telemedicine aspect? How can we do this with respect and dignity?
Well, I think it's going to be specifically office driven. I can tell you what we're doing here. When we receive a call and a patient reaches out, we're currently giving them the option of in-patient evaluation versus telemedicine. But there's some concerns about social distancing and isolation. In terms of bringing our patients in, we are very cognizant of the fact that we want to separate and one will not want to crowd our waiting room so that people will be in close proximity to each other. That may be the patient that we encourage that and really deep down and discuss these options with patients that may not be feeling very comfortable with or have a high degree of digital literacy. We also offer phone evaluations. If they don't feel comfortable with the simple fact of actually me seeing the patients, we offer equal time by me talking with them over the phone and discussing any concerns that they may have. So there's different areas and different degrees of telemedicine, from just a simple phone interview and conversation. If someone feels more comfortable, if they have the availability of a computer with access to a camera or a smartphone, we are able to gently and carefully bring them through the process so that they feel comfortable with telemedicine.
Thank you. One of our other questions was, should a patient have any information ready for their doctor before a telemedicine visit, such as should they have taken their own temperature, their blood pressure, bring their medications list with them?
All of those would be very helpful in the discussion. It won't be absolutely necessary to go out and purchase a thermometer or check your oxygen saturation, but if you have that capability, that would be more information that we have. And it's usually a pre-screen process that the nurse will actually talk to the persons that are going to be involved in the telemedicine visit. That would involve obtaining a short history, what previous medications they may have been on, prior surgical history, or any other information that the patient deems that they will want to relay to me. Once that occurs, then there's a kind handoff from my nurse over to me. Then I will have a chance to review that several minutes before I engage the patient through telemedicine. That process has been very effective. It gives an opportunity that the patient is able to bring their information, they're up to date on what they want to do. It's given to my nurse. I have a time to go over that information, and we can discuss that from an interview that may last anywhere from 5 minutes to 45 minutes to an hour.
Okay. All right. Thank you. Given that we know some people are uninsured, how are the telehealth services being utilized for individuals that might not have insurance?
Where me, specifically in San Luis Valley, we're in a very unique part of the state where there's a high incidence of poverty, anywhere from 20 to 25%. And San Luis Valley Health has always been a leader, and we do not turn away anyone. We do have the capability to offer financial assistance to individuals that are totally uninsured. Majority of the patient population that I see is Medicaid, and is covered through that. And unfortunately, the U.S. government, the federal government, has relaxed a lot of the guidelines that was restricting accessibility for telemedicine and the use of physicians to use this in a greater community. And the ease in which they have done that has made this a much more palatable process. But we at San Luis Valley don't turn anyone away. We're committed to healthcare, And I'm sure that in this environment of people losing under economic distress and loss of jobs, that there are other organizations similar to San Luis Valley are very understanding and will find avenues that they can mitigate any financial restraints that would prevent someone from seeking accessibility for healthcare.
Okay. And now, more than ever, people are experiencing feelings of anger, unease, and trauma. And are there telemedicine resources available to help this process and work through these emotions?
We're at a defining moment in the United States at the present time. There are currently probably 3 pandemics going on. The first one being the COVID pandemic, which led to an economic pandemic, which has resulted in anxiety, depression, and loss of jobs. And most recently, as we see, there's this social awareness pandemic of the events that have occurred in Minnesota and across America over the past week. And a lot of people are feeling different feelings, anxiety, depression. And we have an excellent service within the Valley that is headed by Laura Burkhart that provides behavioral therapy and counseling that's in the form of integrative medicine, that she is aligned with our primary care physicians and internal medicine physicians and coordinating a team that can provide strategies and tools that someone may have during this difficult time, whether it's anxiety, grief, economic disabilities, alcohol dependence, opioid dependence. It runs the gamut. In addition to the services that we have here at San Luis Valley, we have the San Luis Valley Behavioral Health. And the team in San Luis Valley Health and the behavioral health team, they're working together in providing resources. Telemedicine also provides the opportunity for a patient, if needed, to have accessibility to see any psychiatrist in the area. It'll be via telemedicine, but in rural America, as well as we can find in all areas of the country, there is a shortage of physicians. In rural America, we may have 100 physicians per 100,000, as opposed in the urban areas, there may be 2 to 3 times that. So telemedicine does provide opportunity for those services that typically we won't have in the rural areas, such as Alamosa, to provide psychiatrists and our own excellent team of behavioral therapists to counsel those patients during this transformational time in our country.
Okay, that's good to know. Some other questions from our group. Does a telemedicine visit carry the same level of weight as a medical visit in terms of updates to my medical records and or use for medical treatment or prescriptions?
Good question. Medical record, that we're still in transitions. And I think that's one of the areas that the transition of medical records and incorporation of telemedicine at the same time, we still have some work to do. But that is an ongoing process and is continuing to morph as we speak. In terms of medication and preventive care, telemedicine serves, if not a more important, as important role as an individual face-to-face visit with a provider. Particularly in terms of, mental health. Some people may feel uncomfortable seeking a face-to-face visit with a provider. But if they're able to have some type of privacy within their homes, they may be more willing to seek care, counseling with their primary provider.
Another question.
terms of accessing telemedicine. But some others, such as Facebook Messenger video chat, Google Hangouts, Apple FaceTime, and Skype, are approved platforms by the federal government and have known to be, as what we can determine, HIPAA safe in terms of discussing information with your provider via those platforms. Now, in terms of privacy, that can go both ways. And if you're in your home and you want to talk to provider in terms of mental health, that may be a challenge for them in other ways. They may have family members or people that are residing with them that they will not want to know and be privy to the conversation they may be having with their provider. That might provide some challenges in respect to that. On the other hand, some people live with family members that are the primary care provider, and it's very important if they can engage in the conversation with the physician that could help optimize a better outcome. If you have a family member who's talking with them and they can be involved with the discussion in terms of medication, compliance, that is also, on the other end, could be a very positive thing.
Okay. All right, thank you. One other question. Many health apps now collect self-reported information that may be helpful to doctors during telemedicine visits. Do you recommend that your patients regularly collect this information? And if so, is there specific data that is more helpful for patients to regularly document to support diagnostics and care as it relates to chronic diseases that disproportionately impact our community? Long question.
Yeah. I think information can be very valuable and very dangerous at the same time. I think if we're cognizant of the fact that the information that we're received via social media, we take that in context. If there are some symptoms, some of the major symptoms of a disease process, such as hypertension or asthma, I think they should use that as an opportunity to reach out to their primary care physician so that they can further peel back the layers and actually see if that particular process pertains to them. I think it would be a fault on what they may read, media or internet, before taking that information, using that information, but it opens up as a dialogue that they may have with their primary care provider. I think you should be cognizant of your health. You know your body is best. If there are some concerns, seek out information, but also use that information in the context that you would want to get an expert professional advice from a medical professional.
So I want to go back to the coronavirus, the COVID-19, with the question that is just sort of burning here for many people, and it has to do with a cure. Do we have one? Is there a special pill or whatever? Have they created it? Do we not know about it, or is it just not here yet?
Well, this is, I'm sure, the burning question. But before I embark on that, we may not have a vaccine at the present time, but there's been some recent data in the last several weeks that some of the practices that we've been pushing for the last 2 weeks have been very effective. Social distancing, but more important, wearing a face mask. Some of the data that I recently saw, there's maybe a 50% reduction in your potential of obtaining coronavirus if everybody wears a mask. So we don't have a vaccine, but we have a 50% effective tool that is at our disposal right now. And I think it's very important that we should push that narrative. Continue to wear your face mask. Continue to have others around you wear your face mask. If possible, continue to practice social distancing. That is somewhat becoming a little bit of a challenge now, since not just us in Colorado, but all across the nation, we're beginning to return to somewhat the new normal, whatever that may be. I think we're still transforming into what the new normal is. The one thing that is very, very, is no doubt, wearing your face mask. There's, I believe, South Korea they were very early and proactive in using the face mask. They're a very large country, and I understand there may be 400 deaths at the present time. So it's effective. Now, getting to the specific question about the vaccine, what the federal government, the National Institute of Allergy and Infectious Disease, in conglomeration with the private sector, public sector, pharmaceutical companies, are trying to address in vaccine. From my understanding right now, we're trying to do 2 years worth of work, hopefully within 6 months to a year. That has presented a challenge on a number of fronts. There's not, from the research I've been reading so far, there's not going to be a one pill, one bullet, one vaccine cure. There appears to be a direction that's going to be on a multi-pronged point. The beauty is there's coordination, both nationally and internationally, that a large number of resources are being put to different avenues of how they may attack the virus. One of the major areas they're looking at is actually the structure of the virus. The virus has a coat of proteins on the surface, and a lot of the research is directed on how can we prevent this coating of the surface on this RNA virus from entering the human body. And it's known that there's some receptors called ACE receptors that are present in everybody. They're more prevalent in some than others. That may be in a way of how we can prevent the combination of the virus connecting with these receptors. So that's a very simplified area of how they're looking at the research. They're looking at other medications such as antivirals, remdesivir and another one called Starforma. Those are two of the medications that actually work against the virus and prevent the replication of the virus once it enters the body. So we have a certain number of companies looking at that. Then you're looking at a third phase of potential vaccines, where they're looking at a certain number of drugs that could potentially reduce our own body's immune system from reacting to a foreign substance such as a virus. And some of that's going through some of what we see as convalescent plasma transfusions that they're doing in some clinical trials across America, or the use of what they call monoclonal antibodies, which reduces the body's immune system to fight an infection. That can be a double-edged sword. You can reduce the immune system so much that other types of substances and bacteria may affect the patient, but you want to find a happy medium. So there's virus by your own immune system being interactions. This is a virus that has very subtle differences and different people react to it differently. So with that being said, to make a widespread, consistent reaction of a medication to one person, it presents somewhat of a challenge. I'm optimistic, and from what I'm reading, I'm optimistic there will be a vaccination sometime by the mere fact that we've had two predecessors, serious acute respiratory syndrome that became apparent in the world in 2002, and Middle East respiratory syndrome that came out in 2012. We were able to successfully find a vaccine against those two entities. And they're cousins of the coronavirus too, that we currently see that's causing this pandemic. There's differences, but some of the medications that they're looking at, they use in prior studies on those previous coronaviruses. Coronavirus is hundreds of viruses, but there's 7.
I'm going to have to stop you right there because we have run out of time.
Oh, okay.
And what I want you to hold that thought, because this is giving us some food for another meal on this discussion. So I want to thank you so very much. And I just want everyone to know that as we acknowledge that during this time of crisis, that we may need to connect more with one another and acknowledge that we are not okay, to please take Dr. Ellison's suggestions and his information, if you're in the San Luis Valley, about reaching out to someone. Don't just sit and wonder if you're okay. Reach out to somebody and have that discussion with them. We will also be doing a special Facebook Live with a focus on our mental health. So we want you to look for those details about that in our Facebook Live, in our upcoming email blast, and on our Facebook page. What we also want to do is, again, thank you for taking this time. And we want to make sure that everyone stays safe, washes your hands, wears your mask, practices social distancing. And if I didn't mention it, wear your mask and wash your hands. Thank you so much.
Thank you very much.